How do you pay for unexpected medical costs in retirement? Very interesting. And I've been focused on this. A part of my book I had written, You Can Retire on Social Security. So it's around here someplace. I talked about this. My last book, Relax and Retire, I talked about as well. But anyway, right here, how do retirees cope with uninsured healthcare costs? Very interesting here. Long-term care costs are generally not well insured, posing a significant risk for households as they age. All right. Let's see. Among those who do need long-term care services, few find it necessary to move in with their kids, but they do expect to leave them less money. Interesting. And then they go on to say, while retirees are relatively well insured against medical shocks, they are very exposed to unexpected long-term care shocks, often lead to a drawdown of home equity or reliance on Medicaid. So remember, I just want to show you. Among those who do need long-term care, few find it necessary to move in there with the kids. So medical shocks, long-term care shocks are two different things. Because we all have Medicare essentially, and most of us have either Medicare. Well, I'll show you. I actually got the numbers. I think it's 47% got Medicare Advantage. Yeah, 47% got Part C. The rest of us have traditional gap, Medicare, and a supplemental policy. Some have a supplemental policy through their employer. Some have used Medicaid as a supplemental policy. So you got basically 50% of the population with Medicare Advantage Part C, supplemental policy through employer like the Federal Employee Health Benefits, supplemental policy through your Plan G, Plan N, and then you got Medicaid as your supplement. And so basically right here we got about 5% who just do Part A and Part B alone. And that's stupid. Don't do that. So you can see we're very well covered for the expected shocks from Medicare. See right here, 2024 Medicare Advantage plans were required to cap annual costs at $8,800 for in-network services and $1,330 for out-of-network services. And since many households are married, the cap is effectively double for them. So this is the shock. This isn't a shock. This is the most likely scenario. If you had to pay everything, you'd pay $17,000 if you're married, or $26,000 if you're married, depending on if you're in network, out network. I mean, that's a lot of money. Don't get me wrong. If you had to pay that consistently, that would suck. But very, very few people do. That's just a fact. Some who do, that stinks for them. No, there's no two ways around that. But that's not a real medical shock. We're talking hundreds of thousands of dollars, what most people are worried about. So let's keep going here. While retirees are fairly well protected against the cost of medical shocks, they are exposed to substantial long-term care risks. About 80% of those 65 or older will require some long-term care, with nearly 20% requiring high-intensity care for more than 3 years. Okay. And again, we go back to what they said here. Among those who did need the long-term care, few find it necessary to move in with their kids. But they say right here, so it's very confusing. That's why I'm here to solve it for you. 20% require high-intensity care for more than 3 years, even though 80% require some form of long-term care. I just want to point out that just because you need long-term care, it doesn't mean you go to a facility to receive it. In fact, I was just walking to Costco today, and a nice older lady was walking hand in arm with her daughter, walking through the parking lot because she needed help with transferring. And she probably needs help with assistance and that nature. You know what I'm saying? So she probably doesn't drive, but she wanted to get out of the house, and her daughter probably went to pick her up and helped her. And she's a very friendly, nice lady. That's a form of long-term care that she needs, and she's being helped by her daughter. All right, so just because you have long-term care needs doesn't mean you're going to a facility. I can't stress this enough. All right, let's keep going here. All right, so you're not going to get on Medicaid because you got to spend down all your assets. It's not going to happen. So the lack of insurance for formal long-term care coverage is troubling, given that the median annual cost, and again, this is where the freaking ticks me off. The median annual cost is $117,000 for a private room in a nursing home, $64,000 in assisted living. Again, they're making the jump from needing long-term care to spending that kind of money in a long-term care facility. They're equating that, and it's just not synonymous. They're just not. You can get long-term care without going to a nursing home. In fact, the vast, vast, vast majority of people don't. All right, and some retirees are exposed to moderate medical spending, mostly capped at around $20,000 a year. That's probably your max out of pocket for most people. While no small sum is unlikely to completely derail a household's long-term care finances, although may require adjustments. In contrast, the cost of long-term care can easily overwhelm household finances with just a few years of intensive care. And what do they say here? 20% require high-intensity care for more than 3 years, but that doesn't mean that 20% are going to a facility. That just didn't. But anyway, you can see right there. So that means 80% didn't. All right. So anyway, let's keep going because I thought it was very interesting. So what happens here? They're going to do a survey. They're going to look at the survey from the Health and Retirement Survey from University of Michigan. They do 20,000 surveys a year, does HRS. 20,000. And they're going to come up with a survey. They're going to show us the results of demographics for the HRS survey, respondents with $100,000 in investable assets. Again, they're surveying over 20,000 people a year. Now, not all those people have $100,000 in invested assets, I grant you. But they're saying of the people who had a long-term care shock, of the 20,000, there's only 1,396. All right. And again, this is how many people that I want to show you something. These are surveys going back 1992 to 2020. They survey 20,000 people a year. Again, not all these 20,000 people have $100,000 of investable assets, but you can see a very small minority of people actually have long-term care shocks. What is a long-term care shock, you might ask? So let's check this out. Long-term care shocks and medical shocks are individuals considered to have had a medical shock in a given year if the spending was in the top 10% of medical out-of-pocket expenses in that year. For long-term care, because out-of-pocket spending is relatively rare, because of out-of-pocket spending is relatively rare for long-term care, a shock is defined as having any long-term care-related spending. What? Because any spending on long-term care is considered a shock because out-of-pocket spending is relatively rare. This process yields about 1,500 unique individuals in the long-term care shock group of the 20,000 surveyed. All amounts are 20,000 each, it says, by every 2 years. So we have 1,396 of the thousands upon thousands of surveyed people. We only have 1,396 who have any long-term care expenditures, because most long-term care, as they said here, because out-of-pocket spending is relatively rare. A shock is defining as any long-term care related spending. Now, again, that lady who's walking with her mom down to the Costco, she's not getting paid on that. That is a long-term care expenditure in terms of time, for sure, but in terms of expenditures, it was not. And then she gets to spend some time with her mom. Is that a bad thing? But I just want to show you a very few number of people in the overall scheme of the numbers surveyed are actually have long-term care shock, and long-term care shock is defined as having any long-term care expenditure. And you can see right here, they're 82 years old. Was the average, I don't know if that's the average or median age, I don't know, but 82 years old, older people. Very interesting, is it not? And how much they actually spend, right here. Figure 2 displays the cost in the year of the shock for those with long-term care shock. How much they actually spend. The average was $10,000. A standard deviation of 17,851. That OP is out-of-pocket expenditures. Total out-of-pocket expenditures, $10,000 for long-term care shock. Okay. Healthcare shock right here, $12,000 was your average, with an $18,000 standard deviation. That's 4,000 people. So more people so look at the medical shock, even though it's more highly covered from catastrophic coverage, was much more painful in terms of overall out-of-pocket coverage, OOP, and it will affect a lot more people. Why? Because not that many people have long-term care shocks. And again, long-term care shock is defined as someone who has any kind of long-term care expenditures. Total medical out-of-pocket expense, $5,200 right here is twice that for medical shock. Finally said, these findings suggest that long-term care shock was the reason for the increase in Medicaid enrollment because they spent down all their assets. Here you can see the number of people on Medicaid previous to the long-term care shock was basically zero. Percentage of respondents who have an LTC shock on Medicaid, nothing. Then they have the shock and it dropped to 1 to 9%. 9% of the respondents had a long-term care shock that put them on Medicaid. I mean, not actually, Frank, I don't know if that's 9% of these people, the 1,396 of the whole thing. Either way, it's not very high. It's just not very high. Finally, some comfort can be taken into the fact that the results show no evidence that individuals who suffer a long-term care shock actually move in with their children, and most of them were living within 10 miles of our kids anyways, what they said in the survey. This pattern is consistent with a distinct preference of respondents in the survey to only move in with their kids as a last resort. Yeah. Individuals seem to have three methods of absorbing long-term care shocks: drawing down wealth, particularly the home equity, possibly as a consequence reducing their bequests, at least for modest bequest size, they're falling back on the quintessential safety net, Medicaid. All three of these are quantitatively similar when the sample is not restricted to households with $100,000 in financial assets. Of course, this assumes you don't have long-term care insurance. We know you're going to have health care insurance through Medicare, most likely a supplemental policy, not a Part D. I mean, a Part C. You can have a Medicare Advantage, I don't care. But generally speaking, I'd recommend a supplemental policy instead. But this assumes you don't have long-term care insurance, and yet how did you end up coping with it? Well, it's just, I'm telling you, man, it didn't affect as many people as a situation you would think the media would lead you to believe, or the financial industry as a whole. Oh my goodness, we're all going to have long-term care. The evidence just isn't there. It's just not. Anyway, love your thoughts. Maybe you got a grandma who's going through it. My grandma was in a long-term care facility for about 12 months, something like that. I think at $10,000 a month up in New Jersey. Sucked. Expensive. She paid for it out of pocket. My mom's in a facility right now in Virginia Mennonite Retirement Community. Sucks. Ain't cheap. It's expensive. She's paying for it out of pocket. At some point, she'll run out of money. She has to sell her home. You know what I'm saying? I mean, this does happen on occasion. It's just very rare. Very rare. All right. Love your thoughts. God bless. We'll see you.